So Calandra, for this part of the examination, I'm going to be doing a postural assessment. And what that's going to entail is I'm just going to have you stand here in a relaxed position. And I'm going to be looking at you from a few different angles. So from the front, the back, and then from either side. And I'm going to be seeing just your positioning of your limbs and your other body parts in relation to each other, and looking kind of the bony aspects, and then any sort of muscle bulk as well. How does that sound?
Good.
Okay, so I'm going to start with you turning around, and I'm going to start looking at this angle, just standing nice, relaxed, looking straight ahead. And so from here I'll start superiorly, and from here I'm going to find T1, so I'm going to have you tilt your head forward and then backward. Good. So I found T1, and then I'll find the superior angle, and then I'll come down to T2, and you can see they're just about in line, maybe a tiny bit depressed. Same thing on the other side, maybe like a hair, so nothing to worry about there. And then going down a little bit, I'll just find the spinous process and then the medial border of the scapula, and you can see that it's a little bit more than 3 fingers, maybe 4 fingers, so she's a little bit abducted. About the same on each side, about 4 fingers. So with that, it could be because of either tight musculature in the front, like the pecs or something like that, that's rounding them forward, or weak rhomboids and middle trap that's preventing her from keeping her scapula pulled back. And then we can look at the medial border again and seeing if it's protruded away from the thoracic spine. It doesn't look like it is at all. And then we can go down a little bit further and then look at the angle of the border, and you want it to be a little bit upwardly rotated. So we can see, if you wedge your web spacing around the inferior angle and then having your index finger along the medial border, you can see that it's a little bit upwardly rotated on that side, and then a little upwardly rotated on that side as well. And then we can go down again and look at the inferior angle, and you can see that there's some protrusion there, so some anterior tipping, and that could be from weak lower traps or some tight pec minor in the front and pec major. And then I'll have you turn to the side for me, and then just look straight ahead again. And here you can see a little bit of lordotic curvature at the cervical spine, and then it comes down to some kyphotic, and then it sort of flattens out in the mid-thoracic right around kind of the T3 level, right around to the T6 or 7. And then it comes down, you get that lordotic curvature in the lumbar spine, so that's fine. And then the shoulders, you can see that they're a little rounded forward, which matches with the abducted scapula. And then if we look at the acromion and then the head of the humerus, you can see that she's a little bit anterior, maybe slightly more than a third. So that might be from weak lateral rotators and tight medial rotators of the scapulohumeral muscles. And then I'll have you turn to the front, Callie. And then from here, you can look at the clavicles, and you can see that there's that slight downward angle. The SC joint's lower than the AC joint, which matches with the slight upward rotation. And then if you look at the cubital fossa, you can see that it's pointing slightly anterior medially. And then if I have her turn around to the back again, you can match that up with the olecranon, and you can see that that's slightly posterior lateral. So from here, we would test, or it would indicate us, or drive us to test the musculature that we saw that was sort of loose and possibly weak, and then also testing the flexibility of her anterior musculature, some of the ones that were tighter, like the pec minor. And then we're going to do some symptom modification or posture correction, having her roll back her shoulders, decreasing that anterior tilting, just to see if she can get there, see if it is weak or if it is the tight. And then we can have her pinch her shoulder blades together in the back and see if that affects her symptoms at all. And that could drive your hypothesis. And then that would be Okay, so Callie, for this next technique, the reason I'm doing it is because when I was doing your physical examination, when I was doing my pressing on your spine, on your joints throughout there, I noticed some places that were pretty stiff, and this technique is going to help loosen those up and hopefully get some more movement so we can improve your symptoms and make some of our other interventions a little bit more effective. So what you should experience here is just going to be a short, quick force that I'm going to apply. It's going to be kind of me on top of you, coming through my chest, and it's going to be pushing down towards the table with my hand underneath you, and that's where all the force is going to kind of come through, and it's going to cause a cavitation, which is going to be like cracking your knuckles. So nothing you should be worried about, super safe. And then aside from that, you might feel some discomfort just from the pressure I'm applying, but no pain, and that should be it. So how do you feel?
Good.
Okay, so I'm going to be leaning on top of you, is that okay?
Mm-hmm.
Okay, so I'm going to have you cross your arms across your chest. Perfect, just so those elbows are lined up. And I'm going to have you bend this knee, so I can roll you over towards me. That's good. I'm going to bring my hand underneath, find your spinous process that I want to work on, and bring my thenar eminence in there, and then pull down, rotate a little bit, and then I'm going to compress your elbows, bring you back over, and I want you right on top of my hand, and then I'm going to rock you back and forth so I can get a little bit more pressure in there, and then I'm going to have you take a big deep breath in and then breathe out. Not yet.
Oh, okay.
And then after you breathe out, that's when I'm going to apply my quick force, just so you know when it's coming, but I want you to try to relax during the whole thing. So close your eyes, nice deep breath in, and then out. Good. How was that?
Good.
Yeah?
Yeah.
Okay. So we've got a nice little cavitation there, so we're going to take her through some exercise and hopefully get a little bit more mobility.